Mental Health Awareness Month, and at KidsTLC, they've adapted for COVID-19 while maintaining their clients' well-being.
Kathy's on that story. Kathy?
Yes, so their clients are children, their kids, and of course the families. And I've got Dr. Dugan with me right now to talk about this. Now, COVID-19 has kept a lot of these kids from seeing the kids that stay here, their parents. So how have you been able to cope with that?
Very difficult. So 75 kids live here on campus. This is home. And for about 2 months now, they haven't seen their families, and their families haven't seen them. So we're working really hard. Great lessons in resiliency, great lessons in coping with difficult situations, but we're anxious to reunite and get some visits going again.
And great lessons with Zoom.
Oh, lots of virtual visits going on. We've all learned as families and kids, but it's not the same as seeing each other, and so we're hopeful the next couple of weeks to get families back on campus and start some visits.
So the thing is, you want to get these kids who have, let's say, emotional, mental, behavioral issues, you want to get them back in the family coping and communicating.
We absolutely want to reconnect, right? We're building relationships, we're building back in trust, and we have to have families together to do that. And families are as critical to the treatment of the children that live here as the treatment the children receive. So our staff have been amazing families for now, but we're anxious to get kids reunited back with their families.
And how is important is it, for instance, like we're one-on-one, we're, you know, the social distancing and everything, but how important is that for a child to be with their therapist like that?
Think about that for us. Physical connection, reading facial cues and body posture makes a big difference. And so our therapists and kids are remaining good social distance, but together physically to help each other through this time. And that treatment's just been essential. KidsTLC is an essential service, and the mental health of kids is certainly critical and essential.
Oh my gosh, you've been here 2 years. You've been, you know, within the school district here for many, many, many years. Kids, they are our hope for our future.
They are absolutely our hope, and I've been amazed at the staff and the resiliency and the care. Folks realize very quickly in times of challenge that we have to take good care of our most vulnerable kids. That's the kids living here. That's the kids we're doing telehealth with and outpatient services.
Telehealth, that's another way.
You bet.
That's right.
So we have an entire line of service all on telehealth right now, and families and children have need it now more than ever, and it's going very well.
So if people would like more information, they go to your website?
Absolutely, kidstlc.org. Lots of great information.
Thank you so much. You stick around with me. We'll come back next hour.
Love it.
Thank you, Dr. Dugan. Back to you guys in the studio.
All right, Kathy, thanks.